Do statins cause brain fog? Maybe you've been on statins for a while and you've just noticed that your memory's not quite as sharp and you're not like as clear as what you used to be. And you've probably just chalked it up to feeling older. If that sounds like you, then you are in the right place. I am here to answer that question in today's video. My answer may actually surprise you. Let's get started. Hi, I'm Dr. Kelly Shockley, Doctor of Cause, Chiropractic, board certified in sports medicine, and specialized in clinical nutrition. In this video, we're going to go over the hard truth your medical doctor won't mention when it comes to statins. The standard of care does not want you to know these details. Then we'll cover the most common mistake you're unknowingly making because you've been taught that these foods are actually bad for you. And finally, I will be sharing with you a little known method for getting off of statins and achieving mental clarity again. Let's dive on in. What is the hard truth about statins that no medical doctor is going to mention? First off, I have been in practice for going on 17 years now. And I talk to my patients about what medications they're on a regular basis because it's important for me to know because of the types of treatments and interventions that we offer here at this clinic. Not only is it at the clinic, but it's also with patients from outside of this clinic, anywhere within the United States. And it's always interesting to me when I find out they're on a statin. And I start asking more questions of, have you been informed of like how these work and what's happening? And like, why were you put on them in the first place? And when I ask the question of, were you told how these actually work? Nobody has ever said that they have been. So it's kind of been jaw-dropping to me, and I've cross-checked this with some of my colleagues and one of my main mentors, and nobody's getting filled in on how statin drugs actually work. The most common reason why people end up on a statin drug, these are those cholesterol-lowering drugs, is because the cholesterol is high. And the way that the standard of care works, which is the system that all medical doctors are in, okay, this isn't about them, this is about the standard, the system that they're in. It dictates that if cholesterol is high, they have to prescribe a cholesterol-lowering medication. And the thought is that this is what's going to help prevent you from having a heart attack, okay? 50% of people who have heart attacks have normal levels of cholesterol. So I'm not so certain that cholesterol is the bigger piece of the equation as to why you end up having that. And the way that the standard of care works is that the doctor prescribes the medication and the patient takes that medication so that the thought is, if you take this medication, it's going to prevent you from having a heart attack today. And all that the standard of care is liable for is what happens to you today. It doesn't matter what happens long term. So let's talk about how these medications actually work. Did you know that every single cell in your body has cholesterol in it? Like every cell membrane, the walls of the cell are made up of cholesterol. Your hormones are made up of cholesterol. Your brain is made up of cholesterol. Like 20% of your brain is cholesterol. The insulation that goes over all of your nerves that helps with the communication process is called a myelin sheath. It's made up of cholesterol. You have to have cholesterol in order to be living, and definitely need normal levels and like optimal levels for optimal health. So if it's in every single cell in the body, that means we do have to have it. And guess what? You have a manufacturer of cholesterol in your body, and it's your liver. It's one of the 500 jobs that it's supposed to do all day long, 24/7. It produces cholesterol. So when you take a cholesterol-lowering medication, those medications don't work to just strip out cholesterol plaques from in your arteries, which is what the whole standard of care seems to say it's concerned about. No, it's not smart enough to do that. What it has to do is it pulls cholesterol from anywhere in the body, but it also ends up making your manufacturer sick. That's how you actually lower cholesterol quickly. It's not that cholesterol level is evaluating the cholesterol plaques that are in your arteries, guys. No, that's just your overall cholesterol level. So the way that you see that drop dramatically is by making the source sick, making the manufacturer of the cholesterol sick so that it can no longer produce cholesterol in the same way. But here's the thing. I just told you all these other structures and tissues and cells that have cholesterol as part of its makeup. So if the statin the cholesterol lowering medication is not smart enough to go in and just pull the plaques out of your arteries, then guess where it's all coming from? Not only is it making the liver sick, but it's pulling cholesterol from your building blocks for your hormones. It has the ability to affect negatively every single cell in the body because that's what the cell structure, like the walls, the membrane is made out of. And then how this relates to brain fog is 20% of your brain is cholesterol. It's one of the main building blocks of your brain. And those myelin sheaths that go around your nerves that help with communication are made up of cholesterol. So if your body is having cholesterol removed from everywhere, eventually, because the brain is so rich in cholesterol, you are going to probably experience some brain health related symptoms because you don't have the building block. That can show up in the form of brain fog. It can also show up in the form of lack of short-term memory, lack of focus or concentration, mood regulation, being able to sleep at night. Like everything your brain controls from a cognitive standpoint are things you would probably appreciate more, but not necessarily attribute to it being the result of being on a statin or a cholesterol lowering medication. Now, I'm curious, did you have any idea that that is how statin cholesterol lowering medications work? Let me know your response down in the comments. Can't wait to see if somebody's actually heard this process from their doctor. So let me know. Drop them down there. What is the most common mistake that you're unknowingly making because you've been told to avoid these foods in your diet? Well, it's avoiding your healthy fats and cholesterol containing foods. Let's talk about the cholesterol containing foods first. Came out probably about 3-4 years ago, definitely less than a handful of years ago. Now at this point where research, science, medicine all said, oh, hey, blood levels of cholesterol is not directly correlated to how much cholesterol you're consuming out of your food. And the sheer fact is, like, obviously, if you stop eating cholesterol containing foods because it's essential for you to live, your liver is going to produce cholesterol that you need. So just cutting cholesterol out of your diet does not take care of cholesterol levels in the body because your liver is going to manufacture what you're not providing, right? The other side of this is part of the fear, like this push for these cholesterol lowering medications is because we're worried about plaquing in the arteries. You know, that's what they are saying is predisposing you to a heart attack or a stroke or some other coronary event. And they thought long ago when they first changed our food pyramid back in 1976 that people were dropping like flies because of heart attacks. So like we need to do something about this. And the assumption was that it was saturated fats that were clogging up the arteries. Nobody did any real research to see if that was actually true. And quite the contrary is actually true. Okay. Healthy, good, and there are saturated fats in here. Those fats actually don't clog your arteries. It's the bad fats that do. But nobody's delineated that for anybody or hasn't done a very good job. And everybody's been taught like you can't eat butter, avoid coconut oil, don't eat saturated fats. Instead, just use olive oil and do all of your cooking with olive oil. Maybe use your vegetable oils, canola, all that stuff. Like, no, those are not good for us. Now, extra virgin olive oil is, but you don't want to cook at high temperatures with it because it has such a low flash heat temperature that it breaks down and it becomes rancid essentially. And you're putting now food into your body that's detrimental instead of being healthy. Margarine is like eating plastic. Okay, literally the structure, how chemically it's made, it's like eating plastic. It is not a safe alternative at all. Butter is totally fine. Butter is not going to clog up your arteries, but you need to get butter from a grass-fed, grass-finished cow. My favorite go-to is Kerrygold. I know they're not the only brand, but that's the brand we use in our household. We also don't shy away from coconut oil. Coconut oil doesn't make you fat. Good fats don't make you fat unless you're eating huge amounts of them and you're consuming way too many calories for what you're expending every day, okay? They are actually really good at reducing inflammation. Healthy fats reduce inflammation. And guess what is a better telling sign of are you at risk for a cardiovascular related event, whether that's a heart attack or a stroke or you name it? inflammation is. I look at blood levels of cholesterol all the time, but I also do it in conjunction with inflammatory markers. And then I look at some other markers that tell me much more about heart health itself. Inflammation is what predisposes somebody to a heart attack and a stroke. And there are ways to evaluate inflammation within the cardiovascular system. And that's what we realize correlates far more of, is somebody at risk than just their cholesterol levels. So if you start consuming these healthy fats that help reduce inflammation and they don't clog up your arteries, you're putting yourself in a better place health-wise, right? And you might even see that by shifting diet, incorporating these healthy fats in and eating the whole entire egg, because most of the nutrient density in an egg is in the yolk. You can eat the yolk. Don't feel bad about the yolk. In fact, every person that I have ever tested who eats a lot of eggs on a regular basis does not have high cholesterol as a result of what they're eating. Okay? Incorporate those in. Those are nutrients that we were designed to live off of and be healthy. Okay? If you avoid the bad fats, you're not going to see cholesterol issues related to diet. There is another factor in here, though. We're trying to reduce inflammation, right? And part of what we need to look at in conjunction with our cholesterol levels are our triglyceride levels. Triglycerides give me more insight on, is your diet having any insight on your cholesterol or not? If you're consuming a lot of carbohydrates from grains, you have a sweet tooth, you're eating high amounts of fruits, and your cholesterol is high, your triglycerides are also high, then I know there's some diet influence in there, okay? We don't want to eat a ton of carbohydrates. That is the best source of food type, right? Macronutrient that inflames our body. Vegetables are phenomenal. Eat as many vegetables as you want. Fruits, keep to like 1 serving a day. Grains are very subject, guys. They are more stressful on the body and result in a lot of inflammation compared to what we're being taught. So those are the mistakes that most people are making because we haven't been taught this information. We've been taught quite the opposite of this information. But rest assured, with 17 years going on in the making of experience, this is what I know works and this is what I know is true. And there's research that dates back long before we ever changed our food pyramid in 76 that supports this information as well. Now, before I get into the little known method for getting you off of statins once and for all and improving your mental clarity, I just want to take a moment and remind you to click that subscribe button down below, turn the notifications on, and give me a big thumbs up while you're down there. I don't want you to miss out on a future episode. I talk about heart health and gut health, brain health, everything you need to know to be able to take back control of yourself and your health so that you can be unstoppable and you can live a glorious, high quality life, be medication free, and achieve what I like to call total body mastery. So again, click the subscribe button, turn the notifications on, and give me a big thumbs up while you're down there. Thanks so much for your support. Now, what is this little known method for getting you off of statins once and for all and improving mental clarity again? It comes with addressing the question of why was your cholesterol high in the first place? If that's the main reason why you've been put on a cholesterol lowering drug, which is the main one that I know of, we need to step back and ask why. Here's the thing. If we only address cholesterol, like, hey, it's high, go on this drug to lower it. And I could do the same thing. I don't prescribe statins, okay, but I use nutrition. I would be doing the exact same thing if I said, oh, hey, do red yeast rice, do omega-3 fatty acids, because we know that they work really well at reducing cholesterol. I am treating the symptom just like medicine is, just through nutrition. And a lot of functional medicine doctors are doing this too, unfortunately. Your cholesterol being high is a sign, it's a symptom of something going on in your body. And the only real way to address this cholesterol issue is to figure out why it went high in the first place. I was kind of alluding to this in the last tip that I was giving you. I look at far more than just cholesterol. I look at a whole gamut of markers so I can get a true appreciation for everything that's going on in the body. But when we're looking at cholesterol specifically, I'm going to give you 2 scenarios. If I have a patient's blood that comes back and they've got a high total cholesterol, they have high triglycerides, maybe their HDLs are okay, that's the quote unquote good cholesterol, and then they have high LDL cholesterol, I also run diabetic markers, so I'm going to look at those too. Generally, this type of presentation, I also see that blood glucose might be on the higher side, the hemoglobin A1C might be on the higher side. And that tells me that their cholesterol being high does have some dietary influence over it. And then I'm going to share with that patient what I just got done telling you of the foods that we want to eat and the ones we want to avoid to work on the diet side of why is this higher than what it should be. But let me give you another example of something I see on a regular basis. I have patients' blood work come back where I see more times than not high total cholesterol, optimal levels of triglycerides, perfect levels of good cholesterol, and high levels of the bad LDL cholesterol. I look at their diabetic markers. Their glucose is perfect. Their hemoglobin A1C is perfect. This is clearly not related to diet. It's not necessarily related to genetics either. What I know with this presentation, based off of what I've been taught, the research I've done, the clinical experience I've had, is this presentation is telling me that that patient's body is in a protective pattern. Now, if I do what medical does, and I just put them on omega-3 fatty acids, or I put them on something directly to address this cholesterol issue without figuring out why they are having elevated cholesterol levels to begin with, do you see that I'm actually potentially setting them up for a much larger problem? We're getting rid of the body's protective mechanism, but we didn't take care of why it was protecting itself in the first place. And now we just made it defenseless. Not going to be good long term. Statin drugs will do the same thing. So ultimately, we have to step back and figure out why is the body protecting itself. And I have seen a multitude of different reasons, from different nutrient imbalances and deficiencies, from a low level, undetectable chronic infection, toxicity issues, you name it, the body is going to protect itself. And the only true way to resolve this and be able to get you healthy enough so you don't need to be on statins, which nobody really needs to be on statins. We just have to figure out what is going on here. For you to be able to have mental clarity again, we have to figure out, why was your cholesterol high in the first place? Why is your body protecting itself? What are you doing dietary wise? And once we address those issues, then you're on the path towards healing again. Now, I'm not anti-drug. Statins are one of my least favorite things that doctors will use though. But I always believe if you have to use a medication, maybe somebody's in a crisis type situation, they're a ticking time bomb, okay? It should be used for that moment in time. And then there should be an exit strategy back off of that. Because we know one of the best ways to set yourself up for dementia, Alzheimer's, is to be on medication of any way, shape, or form. Brain doesn't like it. Now, if you're sitting there going like, okay, Kelly, how in the world do I figure all of this out? Like, what do I need to ask my doctor? How do we need to do this? Don't sweat it. I've got you. All the answers that you need are right below this video in the description. Click on it so it expands. Look for the 5-day health challenge and click on that and submit your information, okay? No, this does not take 5 days. I just took what you need to know of how to figure out what caused your cholesterol to go high in the first place into bite-sized chunks so it's easy to digest, to be able to get through. And you will know by the end of those 5 videos exactly what you need to do to start reclaiming your health. So again, go down, find the 5-day health challenge, sign up for that. I can't wait to see you on the inside of that challenge and on a future episode. I hope today was like eye-opening for you. And I always enjoy your feedback. So drop your feedback down in the comments below too, and I'll see you on a future episode. God bless.